Agicardi uses Dosage and Precautions. Agicardi is a beta blocker medication that works by slowing your heart rate, decreasing your heart's strength of contraction, and widening your blood vessels. These actions help lower blood pressure, reduce the heart's need for oxygen, and improve its overall function. 1 Uses of Agicardi. Agicardi is a beta blocker medication that works by slowing your heart rate, decreasing your heart's strength of contraction, and widening your blood vessels. These actions help lower blood pressure, reduce the heart's need for oxygen, and improve its overall function. 1 Uses of Agicardi. Agicardi is used to treat a variety of cardiovascular conditions, including high blood pressure, hypertension. Agicardi helps lower blood pressure by reducing heart rate and contraction strength, thus decreasing pressure on blood vessel walls. 1 Uses of Agicardi. Angina, chest pain. Because it reduces heart rate and oxygen demand, Agicardi can be used to treat angina. Chronic heart failure. Long-term beta blockers, like Agicardi, along with ACE inhibitors, can reduce heart failure symptoms and improve a patient's clinical condition. 1 Uses of Agicardi. Heart rhythm disorders. Arrhythmias. Agicardi can be used to control certain types of arrhythmias, particularly fast heartbeats. 1 Uses of Agicardi. Prevention of heart attacks. Agicardi can be used to prevent heart attacks in high-risk individuals, such as those who have experienced angina or have a history of cardiovascular disease. 2.1 How to use Agicardi is taken orally. It can be taken with or without food, but it's generally best to take it at the same time each day to ensure consistent medication levels in your body. 2.2 Dosage. The dosage of Agicardi will be determined by your doctor based on your medical condition, age, weight, and response to the medication. Here are general dosages for some conditions. 2.2 Dosage. High blood pressure, angina. The starting dose is usually 2.55 mg once daily. The dose can be increased to 10 mg once daily, up to a maximum of 20 mg once daily. In individuals with asthma or chronic obstructive pulmonary disease (COPD), the starting dose should be 2.5 mg once daily. 2.2 Dosage. Stable. Chronic heart failure treatment must be monitored by a cardiologist. The dose is gradually increased in weekly increments of 1.25 mg once daily in the morning. If tolerated well, the dose can be increased to 2.5 mg once daily in the following week, then by 1.25 mg once daily each week, up to a maximum of 10 mg once daily. 3 Precautions when using Agicardi. 3 Precautions when using Agicardi. Contraindications. Agicardi should not be used in individuals with allergies to any component of the medication, slow heart rate, severe heart failure, cardiac shock, sick sinus syndrome, severe chronic obstructive pulmonary disease, 2nd or 3rd degree atrioventricular block, peripheral vascular disease, severe peripheral artery disease. 3 Precautions when using Agicardi. Cautions. Agicardi should be used with caution in individuals with diabetes, kidney or liver impairment, asthma, chronic obstructive pulmonary disease, thyroid disease, Parkinson's disease, multiple sclerosis, systemic lupus erythematosus, benign prostatic hyperplasia, depression, and mental illness. 3 Precautions when using Agicardi. Side effects. Agicardi may cause side effects, including dizziness, nausea, vomiting, headache, fatigue, muscle weakness, low blood pressure, irregular heartbeat, shortness of breath, stuffy nose, digestive disturbances, sleep problems, depression, and decreased sexual desire. If you experience any side effects, contact your doctor. 3 Precautions when using Agicardi. Drug interactions. Agicardi can interact with other medications, including antibiotics, antidepressants, diuretics, diabetes medications, antifungals, and blood thinners. 3 Precautions when using Agicardi. Pregnancy and breastfeeding. Agicardi can harm a developing fetus. Consult your doctor before using Agicardi if you are pregnant or breastfeeding. Storage. Store Agicardi at room temperature in a dry place away from direct sunlight. For conclusion, Agicardi is an effective medication for treating cardiovascular conditions. However, it can cause side effects. Therefore, it's essential to follow your doctor's instructions and use the medication as directed to achieve optimal treatment outcomes and minimize the risk of side effects. For conclusion, note this information is for general knowledge and informational purposes only, and does not constitute medical advice. It is essential to consult a qualified healthcare professional for diagnosis and treatment.